BW Healthcare World series on quality and patient safety. With me today is Ms. Rama Rajashekharan, who is the Director, Ganga Hospital, Coimbatore, and South Zone representative of Kaho as well. She is with me discussing employee development and engagement in healthcare. So, welcome to BW Healthcare World, Ms. Rajashekharan.
Thank you.
Uh,
Thank you so much.
Ms. Rajashekharan, let me begin by asking you what role does employee development play in creating a thriving healthcare environment, especially concerning the patient care and satisfaction?
Yeah. See, when I talk about employee development, it's very important because in any healthcare organization, employees, it's just not restricted only to my nurses or doctors. The whole gamut of everybody is very important. And at such stage, when we give them because end result is the patient satisfaction. When he leaves or the patient care, they do it. So one of the things I think is very important is they have to have this, develop a lot of interpersonal skills, like, communication skills, have empathy towards patients, very positive attitude, because I always tell that nobody likes to go to a hospital, right? I mean, it's not like you're going out for a movie or out for a dinner. I mean, it's always with a lot of pain they come in, pain, anxiety, tension. So they will try to, put it on us. So you have to really satisfy them. So I always tell them, you have to be very empathetic towards them. So they feel more comfortable. First thing is you have to, from my security, any security or the reception, whom they have to be very empathetic towards them. That is very important. And, have a little, they may be a little depressed, so how positive attitude. So all this really, I'm talking about the paraphernalia, then the medical treatment. These are very important because in some places, they'll say, oh, the doctor just walk in and walk out. And the nurses interact more with them. So these are very important. Their communication, like just saying, okay, fine, you're okay. Not like that, try to be more in depth in it. And especially if the senior head of the department walks in, he just moves off and just say, okay, you're fine. And so sometimes the patients look forward to more of interaction. So that really increases their satisfaction because sometimes they come with a whole list of questions in it, and that I think is very important.
Right, absolutely right. Because when somebody walks into the hospital, it is out of necessity that they have to come there. It is not something which is out of choice.
Yes.
The other thing is that what I've seen is that when a patient walks in or their family brings a patient to the hospital, usually the doctor is the last person they meet.
Yes, right.
By that time, they have to park their vehicle, getting into the reception area, doing the admission process, etc. And so there's a lot of things that they need to go through before they actually meet the doctor for the care that happens.
Yeah.
So, from your experience, what are some of the strategies that have proven to be most effective when we are engaging healthcare staff? While we do that, also, how do we compare that, we need to foster their professional growth, and this has to happen hand in hand.
Yes. See, one of the things is, when we recruit them, I mean, it may be any staff. Of course, they are the values of the organization has to be really told to them because everybody falls in the same line. What we look out for and what we expect from our employees, healthcare workers, that has to be really focused on. And I'm sure any organization, healthcare organization, will of course say patients come first, patient is the most important. It's agreed. But sometimes especially we have in my hospital, I just take an example for you. That has been any emergency which walks in, because ours is a specialized hospital. So any emergencies, we never focus from where he comes, nothing. We don't ask him to pay even the initial fees amount. We take it up In fact, sometimes they shift me up even to the theater, and they start the process, of course, with the consent, and then only this monetary part comes in. So that was something very different. And but in fact, we had never had any issues like, we are shifting the patient. It's okay. I mean, some of them leave, but that's very few, very minuscule number. So I'm just saying one. So like that, we have a lot of values, especially we don't try to differentiate between a high-end patient and a very, poor patient who walks in. So all our values and our vision is really, we try to instill into them. That is one of the main strategies which we had focused on, so that they fall into our framework. And also, for their professional growth, of course, that's very important for them. We try to have a lot of programs, like recently we introduced, especially, retaining nurses is a challenge. And they all like to work like 1 year, and after that they like to leave. So we brought in, like, which can be done in any hospital also. The existing nurses, we bring in a new course called the diabetic certified course or something. 1 year, where the existing nurses, they get exposed to these with the diabetologist or endocrinologist. They have a lot of classes and training and tests and all that, and they get really exposed to those aspects. So they start focusing. When they look at any patient, if he's diabetic, okay, he may have this complication, everything. So they feel a little more empowered. I found that with a lot of nurses, because they said normally, okay, they just go around, but then now and we also give a badge saying you're like a diabetic nurse. That they feel, so patients come and ask if they're diabetic, no, can I take this? Is that okay? And they make sure the dietitian follows in. So they play a double role, which was very engaging. And of course, these certificates it carried a lot of weightage for them. That is one of I'm talking about my nurse aspect. But similarly, we try to do it, especially, of course, now CPR is very relevant for all my staffs. But, we try to bring in the other side. I like to do this role play, wherein we have like, okay, you're the patient, so what will you do? How will you react? So this role play because they felt like they're in their shoes. So that, makes them feel more responsible. And that was a few things which we had done. And of course, we encourage them to take part in our seminars, in our conferences, make them present, and to, all these things which have really added to their from everybody, like from anything. When I talk about my employees, it starts from my security at the entrance to the top management.
Right.
And also when I had got a few feedback from my employees saying that we are all quite, though we have a hierarchy like a CEO and everybody is there on the line. Sometimes they just walk in for any help and then say, no, ma'am, we can approach you. It's not like you're on the third level. Though we are on the higher level, we are approachable. So we have that approachable, and, they feel that family thing they feel more comfortable.
Right. They feel they have an access.
Yeah, they have an access, and it's not.
They'll be heard, and they'll be.
Yeah, that's very true. They can be heard.
Yeah. So, Ms. Rajshekharan, managing employees it appears to be a very simple task, but since we are dealing with human beings, the nurses, the support staff, they're all human beings, which means they have their own sentiments, they're going through their own situations in their life, etc. So they have to be dealt in a very, specific manner. So there's no one size fits all. Now, in the healthcare industry, what do you think are the challenges that the leaders commonly face while they're balancing the employee development initiatives with the demanding nature of the profession that these people are working in?
One of the main challenges, I think, is, especially when you want to do all this, to retain them, that is a very major challenge. And anything we want to do, encourage them or we need, as you say, they're all human beings. The constant planning of things, and how, because they're all quite busy schedule. I mean, they work for 8 hours or whatever. I mean, of course, doctor professionals work a little longer depending on their time. So anybody, so to get them on, I was thinking, like, have like a Saturday is like a half day wherein they're all their we can have more interaction with them. We can have a lot of programs for something which makes them more engaged. So that also becomes sometimes a challenge, because still we work 7 hours and 365 days every day we work. So though they are on rotation, and sometimes they won't, when they, because if it's a very busy hospital, then become very difficult. I find that very much here, because our admission and emergencies and all, it's quite very busy. So for me to get them out, it's like a lot of planning I have to do, and that is the main challenge. Though I want to have so much ideas, the challenge is how will I do it. So I have to do split by split, and try to get them into it. And of course, I think a lot of communication is very important, which becomes like and keep encouraging the thought, like this is in south we use the word called namade means it's ours, like hospital is yours. So in fact we have a lot of pamphlets put up saying hospital is yours. So think like you're part of the family, the big family. That's how.
So it's a kind of a sense of belongingness that you're trying to create as a business leader.
Yeah, yes, yes.
Ms. Rajshekharan, another thing that happens is that you just mentioned that while they're working for those 8 hours, but those 8 hours are strenuous. They're busy in those 8 hours. Now, how does, as a business leader, a healthcare organization ensure that there is a culture that encourages continuous learning and skill enhancement among the employees, especially in today's day and age when there is a lot of technology advancement which is happening, and they need to be trained on the new equipment, new monitoring systems, etc.
See, as you said, it's a good question, because we have AI. AI is, of course, the big thing now. So we have like a robot there, and then a lot of new radiology machines, and which have more. So we try to at least send them for training, or they come over in-house and train them. So it's like a real module. So because they should not feel lost in it, they know something exists, especially suppose it's in the theater. All my theater, from my scrub nurse and all the nurses, the technicians, the OR technicians, everybody learn completely how to handle it. I mean, not the main, what is it? What are the functions? So literally, we make sure that they have at least 2 weeks of training, in-house training. If it is, I'm just saying, in the theater. Suppose it's on the radiology department, then what companies, we ask them to give them the training, hands-on training. So they also feel part of it, how to handle all these things. It's just not, whatever it is, even in a lab, when we have it in a laboratory, when there is an update of a machine, or sometimes they are sent to some seminars or places where they learn and then they come. So they feel okay. I mean, they're a little more empowered to handle it, and they can also teach the juniors. So of course, AI is the robot is it's a big thing now, coming in a very big way. It's already come in. There's
Yes.
nothing. Yeah.
And Ms. Rajshekharan, something that has always been there in my mind is that when we look at private organizations in the corporate culture, there's a lot of emphasis on employee engagement, etc., of how to keep them happy.
Yes.
You know?
Yes. Yeah.
And but when you look at a hospital, like we were discussing, that it is a place when somebody who's coming in is not coming in because of pleasure. It is a necessity for them. They are under a lot of pain. There are a lot of all kinds of pressures that the family is going through. One, the disease, the condition, the financial issues around it, and the fear of losing someone or losing health. Now, the whole atmosphere in a healthcare institution is not the most pleasant one.
Yes.
Everybody is in that pain.
Yeah.
How do you engage with your employees to create the sense of happiness or joy while they are in an environment like in a hospital?
Like this, yes. See, one thing is every week we have like in rotation and make sure it's part of their like work schedule. We have yoga and meditation. We made it for all, from all of them sit together. So that is one, it's like my secretary will be there and my senior nurse will be there, some doctors, all of them sit together and we have a yoga session for 1 hour. Also we have like sports day. They look out for all these, they where they can really relax. So we have a sports day, then we have an annual day, then we have birthday celebrations every month. At the last week, like Saturday of that month, we have all those who are in that month. So we call all of them, and then of course not only just cake cutting, but then we have some small entertainment, some small quiz and prizes. And especially the lower grade 4 staffs, like they get so emotional. In fact, they said even in my house they don't know when I was, because like they don't celebrate anything, or they feel very it is so satisfying for them. These small things, I think, makes a lot of difference when I touch, because this, especially birthday, this COVID time, we didn't do it. So many, madam, you not had any birthday celebration. They think it, and we give them some small gifts. All these small gifts, these small recognitions, and you put them up on the screen saying so and so has done this, performed very well. All that adds a lot to them, men morale, like, because usually on January 1st is the day when we all get together. And I was very surprised. I just met one of my grade 4 staff, and she said for the past 4 years she's working. And for the past 2 years, she's not taken even one day off, and now has come late. I know we recognize her, and she is, no, I like to work here. And she just cleans the room. That's it. I said, what makes you happy? She said, no, but somehow, I'm doing my part of, though I'm not I'm not very well educated, but then at least I can clean. And they said, I said, anybody appreciate you? She said, yes, everybody appreciates me. That was something very nice. I just met her before an hour back. And
So this is really beautiful because, I used to be doing personal branding for doctors at one point in time. And I used to always tell them that, we want our staff to be smiling when somebody comes in, but they don't know why they need to smile. I mean, so it's our duty to let them know that, what they do contributes to the overall care delivery. So they are playing that small role, which is a critical part of the whole larger scheme of things. But, somebody needs to tell them the purpose of why they should do what they are expected to do. That's a very beautiful thing. I'm so glad that you're doing this in your institution. Mr. Rajshekharan, mentoring and coaching is a very important aspect of employee development. They aspire to be somebody, to be like someone else who is higher up in the hierarchy. They look up to people for the right decisions that they're making. They expect guidance in terms of how they can better and grow their career. So can you share some examples of successful mentoring and coaching programs that have significantly contributed to the growth of the healthcare professionals?
See, if you take it personally, in my hospital, it's in fact, it's only specialized only for orthopedics, plastics, and trauma. We don't have any other specialty. And if I take on my clinical professionals, like, I think most of my consultants have been here for the past 25, 30 years. They just don't keep jumping. I mean, they all work here. And I'm starting from their side. So the clinical professionals. So we have more than, I think, 150 PGs here, like, from different subspecialties for orthopedics and plastics and anesthesia. Anesthesia, we're very strong. So when we have all this, and also when we have any of our conferences, it's all, now it's become quite common, but we have, earlier we had, live surgeries, and we were willing to teach not many were willing. They learn all the intricate things of everything. So that makes them feel very, I mean, like we really felt that they look up to all our consultants and our professors, and they think, they're really very down to earth. And we have a lot of visitors. And I think we are one of the first few centers who started on, we do hands-on for microscope training. We have, I think, more than 3,000 people have come from all over the world. From every part of the world, they come here for training alone, just to do on our micro labs. And the main person who teaches them, he was just a technician. He learned the skill and he's teaching them. Of course, they come later to see especially when they do this anastomosis and these veins and, all that, when they plastic surgery, they're very strong now. So they come to what? So they, like that, we really try to make it so that they all go back. So today, I think when I meet all of these professionals in any part of the world or anywhere, we've been to your hospital, we learned this, you feel nice. So that way we are willing to share what we have known in my medical professionals. I mean, doctors. And the next level of my nurses. Today, when I find my nurses spread all over the world, and many, of course, when they say, okay, I worked in Ganga, when they tell these doctors, their department, they love to go to orthopedics or plastic departments. And when they go there and when they tell them that we have worked in such, they're saying, madam, we are put on a higher platform. So, no, that means good. You've seen this type of patients and the exposure must be good. So they feel very, very happy. And that is one of the reasons why we get a lot of nurses. They go to different hospitals. They come here, of course, and they work here for a year and a half. Of course, most of them go abroad. So that is one of their, they look up to the clinical material here is quite huge. We see all types of things. In fact, now Ethiopian government is tied up with us, and the whole surgery is done, sponsored by American Jews. From Ethiopia, patients are being flown in here, and they come with the worst possible scoliosis is the back, spine, very bad. Nobody wants to treat them. So already we have done 40, 50 people, and the cost it's nothing for them. They just take care of the thing, and we do it almost free. But it's very tough on my hospital because they don't know the language, they don't know the food. It is, they're not, it's a real challenge, but it's lovely to interact with them. And, they go back, of course, they go back fine. So like that, we have reached out. So when I talk about mentorship, I think for my doctors or for my nurses or for my technicians, because I have people from Dubai and they come online and say, madam, we are doing so well. We are so happy. We are proud. You feel nice. Because that day, what they told. So they're able to, they really remember everything.
Right.
So that way, I think anything which is, you feel nice, you've done a good job. You've returned back, you've done something back to the community. That's how I look into it.
Got it. And, you said that people are working under pressure, nurses are leaving. There's a lot of, attrition in that area, which means the nurses that are there could be overworked, and there is a burnout that happens, which is a reality. I mean, they're working in a stressful environment, they're working in a sad environment. There is a pressure because there aren't enough people, resources available. And then the extreme case could also be when people were working during the pandemic, when there was a sense of helplessness that was there. There was a lot of sadness. They were seeing so many people dying. Yeah. Now, how do you approach certain initiatives that can be implemented to address burnout and stress that the employees may be going through in an hospital environment?
Yeah, it's a good question because for simple, we have, as I told you, have consultants, senior consultants, from more than 25 years. And if there is, as you say, burnout, sometimes we get very major amputation, hand amputation. They do the replants. So sometimes it starts only at evening 7. It goes on for 5, 6 hours, midnight, 2 o'clock. But my senior most consultant is sitting there. He does the surgery. He's sitting there. He does a surgery, of course, with the other doctors and all. So these, especially my theater nurses and my technicians, initially when we have some people, they said, "How are they able to do it?" I said, "No, this because they focus. Come on, no, we have to make sure that his hand is replanted." I'm just saying an example for that. So I don't know. I thought your voice was getting it. So I think that gives them that confidence that, see, even a senior person is there. Come on, we all have to be there. And of course, burnout, I mean, of course, very stressful. But I think I can very proudly say we are all living examples, because we don't see time. We work, of course, today younger generation want to go on, but then even my senior most person all work. Everybody, they just, because for them patient comes first. So they take in, especially with there being a lot of accidents and trauma. We get burns patients, little children coming in with burns. So the way we approach it, the way my intensive care interventionists or all the departments, the way they all work together, seeing one, I think the senior most, he sets an example and the others immediately follow it up. So that's how they may be a little stressed out at times, but then they get there enough of day offs and all that. So
Got it.
Balances a bit.
Ms. Rajshekharan, while there are certain industries, certain businesses where it is imperative to hire skilled people who are trained, skilled, etc. But there's a lot of emphasis today in hiring strategies to cater towards diversity, equity, inclusion. So how do you factor in certain, employee development and engagement strategies within the healthcare organization to ensure that you're taking care of these issues like diversity, equity, and inclusion?
See, yeah, of course, diversity, equity, and inclusion. They're three different parallel pillars. So when it comes to diversity, it is different. More, what shall I say? We try to suppose there may be different. I'm talking about a technician or a nurse or anybody. They come from different things. So to balance them, it is a little bit of a challenge. But we try, especially if it's in a family, suppose, we try to take care of their children, their education, try to make them feel like, oh, no, we can always turn back to them. In fact, we sponsor we spend quite a bit for my staff's education, children's education. So they feel that balance is there. And when it comes to, what to say, especially inclusion in their development part, we really focus, we pick means, okay, 1 year she's trained here, so okay, what more can we give them? What more can we add on to them? And not only benefits, but as a training, or so that they feel more, little more, definitely more empowered, and they feel like, we can, they can rise up in the ladder. It's not just by the years, but by the experience and by the output and
so you equip them with the opportunity for a career growth and progression.
Yes, definitely. Yeah, they stay or they leave. That's something which we can't.
Of course. And Ms. Rajshekharan, my last question to you before I let you go is, what is your advice to healthcare leaders in the industry of how they can cultivate the culture of continuous development and upskilling while maintaining high level of engagement? We know that in every hospital, there's a shortage of support staff, there's a shortage of nurses. We want them to use their 8 hours to actually do the task that they have been hired to do. But we also want them to develop themselves. We also want them to, equip themselves with better training, better upskilling. Now, what is your advice to the leaders of the healthcare industry to make this happen?
Yeah, see, I personally feel that for them to, I'm sure everybody has the same retention and to retain staffs, and that issues are always there. But how to cultivate this habit thing is, I think, the closeness you have towards them. That makes a lot of difference for them. I mean, it's not like they're not machines. As you said, they're all human beings. So how we try to interact with them, and even a small word, as you say, when you step out or during the lunchtime, when you see them walking, have you had lunch? How was you want those small things? They feel they don't expect it. So doing something which is not expected from them. I mean, from us, they don't expect these small things or anything which is not expected, but we try to do it for them. That adds a little, they feel nice. See, whatever it is, I think at the end of the day, when they go home, they should feel, oh, come on, my senior shouted at me and this, that, because there are mistakes. We're all human. Errors do happen, especially in medicine, here, everywhere it happens. So how you handle such situation? Because you have to put yourself in their shoes, and then you realize, okay, come on. I mean, you just give them a small, like, give a little pat. No, next time you'll do better. Those things really, it stays on with them. And I think the feeling of a family, like, we are always there to help you. We are always there to support you. That family feeling should be there. And it's not like any other, okay, you're my boss and I'm your thing. I think that that really cultivates, and how much individually every person will want for their family. But when we try to do for their family, they feel little more bonded with us. I've noticed that, because the minute we take care of their education or their family support, or they want some, of course, loans, money, all that, you try to address all those personal issues. I think that makes them feel more bonded, because when some of my senior persons said, ma'am, they call me here, but no, I'm quite comfortable here. They offered, then I openly come and say, no, they offered so much in this place. I'm not talking about abroad, but another hospital in the city. No, we prefer to staying here because we feel more like a family. Then you feel nice when they respond to you like that.
Right.
I think that's very important.
No, I think,
I'm just sharing all, just like, what just came to my mind. And
no, absolutely. I mean, this is really beautiful, because, you're talking about actual things that you are doing, which is making.
Yeah, practically, I'm speaking, not very.
Yeah, and the big takeaway was that, when you spoke about empathy, and, I feel that is an inherent uh, quality for every healthcare professional,
Yes.
and there has to be a consciousness in understanding the situation and the mindset of the patient when they come to a hospital, and empowering them with not just the skill that they already have, but the development and continuous learning, so that they can better themselves and create a career path of growth and sustainable growth for themselves. And what was very beautiful is, like, when you spoke about training them in specific things which make them feel specialized and empowered. For example, the diabetic nurse.
Yeah.
So she knows that, she's an expert in this area when it comes to nursing. And that only, that just makes them feel happy about what they are doing. Another very big thing that you spoke about is, role playing. When you spoke about role playing, because when they put themselves in the shoes of a patient, then it just brings in understanding of what the patient may be going through, so that they can address that. If I were in this position, how would I like to be treated? So they know what is expected from the patient, and it makes them feel understood and responsible. And small things like, you in the end spoke about trying to create a family environment, the sense of belongingness, making them feel that they are cared for. And these are these small things that can create a big impact. That's a big takeaway from what I heard you speak. So thank you so much, Ms. Rajshekhi, for taking our time and sharing what you are doing as a practical, doable thing to make a happy environment for engaging employees. Thank you.
Thank you so much. Thank you.
Thank you.